You've seen it on TikTok, you've seen it on Instagram. Vapes in every color, every flavor, glowing, trendy, and everywhere. They look harmless. Some even say they are healthier than smoking. But here's what social media isn't telling you. In 2023, over 2 million American teens reported vaping, and 1 in 4 of them do it every single day. Globally, situation is not better. A study from 47 countries found that 1 in every 12 teenagers had a vape in the past month. If you think your teen isn't vaping or that none of their friends are, that might be wishful thinking. Vaping is not just a trend, it's a global public health concern hiding behind filters, influencer, and fruity flavor. So, is vaping really harmless? Let's clear the air and talk about what science says, not what the algorithm shows us. Hello and welcome to Social Media and Teen Health channel. If you are new here, my name is Dawood Mehrabi. I am a health communication expert, and on this channel, we aim to raise parents' awareness of the positive and negative effects of social media on teenagers, especially their health. We share the latest research findings with you in simple and accessible language. Our mission is to help families support healthier and more informed digital lives for kids and teens. Thanks for joining us. If you think only certain teens are drawn to vaping, think again. A major study followed thousands of teenagers in the US and found that something is very worrying. Just using social media everywhere, platforms like Instagram, TikTok, or YouTube, can increase the chance of vaping by 250%. That means a teen who scrolls daily is 3.5 times more likely to have tried vaping or even to be using it right now, compared to someone who never used social media. Here's the breakdown. They were 46% more likely to start thinking about trying e-cigarettes, over 3 times more likely to have tried it later on, and over 3 times more likely to be current users. In short, daily social media use doesn't necessarily keep teens addicted, but it plays a big role in getting them started. Social media isn't just entertainment. For some, it's where dangerous habits begin. As we all experienced, the more time spent on social media, the more content we are exposed to. One study found that teens who spend more time online are significantly more likely to encounter e-cigarette ads. These ads make vaping look safer than it really is, so much so that teens start seeing it as less risky. And here's the chain reaction. More social media usage lead to more ad exposure, and more ad exposure to lower risk perception, and lower risk perception, higher chance of vaping later. Even when you remove the effect of ads, just using social media a lot still directly increases the chance of vaping. So the main message is social media isn't just showing teens what their friends are doing, it's shaping how safe they think vaping is, and that false sense of safety can lead to a real harm. This is why experts are calling for a stricter regulation on online vaping ads, especially the kind that make e-cigarettes seem harmless. Many studies highlight the urgent need to regulate online advertising of e-cigarettes. A study conducted during COVID-19 shelter-in-place orders and remote schooling found that nearly every teen in this study spent more time on social media, and most saw vaping content online. More than half of these teenagers ended up vaping more. But here's what really stood out. Teens who felt lonely were 3 times more likely to vape more. Those who used vaping to cope were 4 times more likely. And if 2 or more family members knew that they vape, that teens was 6 times more likely to increase their use. This wasn't just about nicotine. It was about feeling isolated, anxious, and looking for something, anything to help. But what helps in the moment can hurt in the long run. So the final word is what teens see online matters. We've seen how social media can normalize vaping, lower risk perception, and silently shape behavior. But vaping is just one example. What if the platforms we trust for connections are quietly shaping more than our habits, maybe even our health, our self-image, or decision? As parents, educators, and policymakers, we have the power to shift the narrative by educating minds, regulating content, and supporting healthier choices. In our next video, we'll go deeper. Is social media really just harmless fun? Or is there more beneath the scroll? Let's find out. If this video helped you, share it and subscribe to support more content for parents navigating teen health in the age of social media. For the sake of teen, watch wisely, share smart.